Hi, Ollie.
Hi, Marco. It's good to see you again.
Likewise, likewise. I know you're slightly under the weather, and I'm not under the weather, but I am feeling impatient. So we're going to keep this episode relatively short and sweet. But we're
Okay.
going to probably do a two-parter, I think, on dignity, which is planets being in their own sign or signs that they enjoy being in, or the converse, which they don't,
Absolutely.
and
Yeah.
and medical charts. So I was just going to start off with a couple of examples from this book. Richard Saunders is The Astrological Judgment and Practice of Physic, where he
Yes.
describes in this. I mean, I know you're familiar with it, aren't you? Really? You've got that. You've
A
have you
wonderful
got this
book.
one?
Wonderful book.
Yes,
I
it's
have the book.
amazing.
Yes.
It's good. Just for reference, it's really cool. So he talks in this about the what planets in different signs mean in terms of diseases and symptoms and stuff. And obviously, it's all in 17th century terminology. But I just wanted to do a little compare and contrast, and we'll take Saturn because Saturn is the planet of chronic disease in traditional astrology. Because obviously, Saturn is the planet that represents difficulties associated with aging and time and attrition and all of that fun stuff. And we'll compare Saturn in Aquarius, which is Saturn in its own sign, to what he says about Saturn in Leo, which is obviously Saturn in its detriment in the opposite sign. So Saturn enjoys being in Aquarius, it doesn't like being in Leo, classically. So he says, Saturn in Aquarius. Aquarius is a hot, moist sign of the nature of the air, light and fixed, vain, which is quite interesting, northwest, and is more hot and moist than Gemini or Libra, more fixed than Scorpio or Leo, and not so much fixed as Taurus, presumably because Taurus is earth and therefore denser.
Yeah.
Masculine,
Yeah.
fortunate, diurnal, henal, sweet in taste, violent, humane, strong, double bodied sign, round and reasonable, of few sons, long of body, weak spirited, and crooked, addicted to women. Interesting.
Mm.
And is the day house of Saturn. And Aquarius, the sign, he says, is associated with diseases and distempers of the shanks, legs, and throat. Now, the shanks, lower legs, that's the Aquarius rules those parts. That's pretty understandable. Legs and throat is interesting. Legs, shanks, fair enough. Throat is interesting, maybe square to Taurus. Hot and moist disease of the blood. So Saturn in the first 12 degrees of Aquarius, he says, is hot and moist in the third degree. So that means quite hot and moist. Interesting, because the sign he says is hot and moist, engendering and multiplying blood, mixed with melancholy and superfluous phlegm, breeding fevers of two fits, with heat inward and cold outward, smallpox, measles, and cankers. And then in the second part of the sign, in the last 18 degrees, is hot in the beginning of the fourth degree, causing diseases of the blood abounding, mixed with melancholy and phlegm, producing the French pox, which would be syphilis, impostumes, cankers, and itches, and diverse such diseases. Because back then, they had all been seen as diseases of the blood. Any comments
Absolutely.
on that, Ollie?
Well, it's
Yeah.
very interesting, isn't it? Because obviously, I mean, from a purely astrological perspective, he's looking at Aquarius is hot and moist as an air sign, and the melancholy going to it, which is Saturn. That's because Saturn is
Yeah.
associated with melancholy, and it's almost as if the blood, the hot noise, is getting hotter and moister, but particularly the heat signature of it, as this melancholy invader comes in, sort of thing, like a
Yes,
redness around a wound, sort of thing, a reaction
yeah,
almost.
yeah, that's it. Yeah, because it's like Saturn. That's an interesting analogy you're getting to, because Saturn is like a scab almost holding the crap in. Yeah,
Yeah,
so sort of Saturn in Aquarius is kind of like crap in the blood. Not that Saturn's always crap, but it's the idea of like
absolutely. Yeah,
holding on to stuff that you don't really want to hold on to, and that's so. I mean, it is interesting. I mean, I think obviously some of those diseases could be quite serious: syphilis,
yeah,
smallpox, cankers, so not trivial. But compare that to what he says about Saturn in Leo. I won't read what he says about the sign. I'll just describe what he says about Saturn in that sign. Saturn in the first 6 degrees of Leo is hot in the first degree and dry in the second, because Leo's a hot, dry fire sign. So in Saunders' system, he prioritizes the sign, causing strong pestilential fevers, hot and very dry, yellow choler mixed with melancholy and superfluous phlegm, causing much vomiting, strong fits of 12 hours, 6 hot, 6 cold, in which they burn mightily and are wonderfully dry, and in the end of the fit they swoon, much like one that hath the falling sickness, that's epilepsy. And when the fits are gone a week, 2 or 3, the least distemper causes a relapse, and it also causeth many times the black plague on them that have this fever. In this disease choler hath the dominion, but is mixed with much melancholy, causeth piles and hemorrhoids, pain of the back. Saturn in Leo causes passion and trembling of the heart through thought and fearfulness. Then he says in the second bit of the sign, in the next 18 degrees, is hot and dry in the third, diseases of thick yellow choler and melancholy. Choler has the dominion with superfluous phlegm, causing pestilential hot burning fevers. So the same thing, but just a bit stronger. So dry that the speech is hindered, stopping of the liver and stomach, forcing to vomit with pains. And then the final bit, the last 6 degrees of Leo, is hot in the 3rd degree, dry in the 4th degree, causing plague, hot pestilential burning fevers, thick yellow choler mixed with melancholy, superfluous phlegm. The dry temper exceeds. It also causeth hectic fevers with a consuming fever, and reigneth in the belly with a pain or stitch in the side. I mean, apart from the fact he's written about 3 times as much there, to me, it doesn't sound like the disease is necessarily worse, but it's almost like he's taking pains to say the symptoms of these are really horrible, you know?
Yeah.
I mean, any thoughts on that?
Well, I mean, obviously, he's emphasizing the dryness a lot when it seemed to me, just from an overview, he emphasized heat a lot for the Aquarius, Saturn and Aquarius, and emphasizing the dry. I mean, they're both hot diseases they're causing. But the heat was more emphasized with Saturn and Aquarius, and the dryness is very much. It's sort of, there's expulsion of liquids, the vomiting, etc., which it was.
So it's the quality of the sign augmented a little bit by the planet, isn't it?
Exactly, but, I mean, and of course. Go on. No, of course, Saturn is a dry planet as well, so maybe he's thinking these two the drynesses are adding to each other, and of course, Saturn is the antithesis of air in that it's cold and dry, and so that seems to have just a more heating effect sort of thing. It's interesting that then that would seem to me why the dryness would be emphasized for Leo.
Agree. I think that's a really accurate observation. I mean, he's definitely utilizing the symbolic temperature and quality of the planet and the sign and putting them together.
Tell me, Marcus, because you've probably read more of Saunders. So basically, Saunders' thing is the more advanced the planet is in the sign, the worse it is, sort of thing.
His technique, yes, exactly. His technique is the further you go round the zodiac, the more extreme the temperature significations of the planets, of the signs go. So Taurus is slightly cold and dry, and then Virgo is more cold and dry, and then Capricorn is the coldest and driest of all the earth signs.
And then 30 degrees Capricorn would be the coldest and driest of
absolutely. And he divides the signs sometimes into 2 parts, sometimes into 3 parts. So sometimes he goes the first 12 degrees and the second 18 degrees of the sign. And sometimes he goes the first few degrees, and then there's a middle few degrees, and then there's the last few degrees. So like in that last example with Leo, I think he did like the first 6, the next 18, and then the last 6 or something like that. Yes, so I'm not sure what the basis of his division of the signs into those segments meant, but the bottom line is they get more extreme as he goes around. So the point that I wanted to emphasize though is, in addition to your very accurate observation about the reason for his delineation in terms of description of symptoms that might be experienced, is that it's not necessarily the case that the planet in detriment or the planet in its own domicile produce objectively worse diseases. But it does sound from the description as though, the way Saunders belabored the description of the symptoms of Saturn in Leo and sort of just said very briefly what was going on with Saturn in Aquarius. He's sort of saying, Saturn in Aquarius can cause these nasty things, but Saturn in Leo oh, it's really nasty. But actually, you know, so this comes to, and I really want to get your opinion on this one, because this is something I've come across and I still haven't fully resolved to my satisfaction. So let me just share my screen, because I've got a little slide here for chart. So we're very, very familiar with this. This is when you're reading a medical chart, like a chart of a consultation, or if somebody's just had an accident or being admitted to hospital or something. This is roughly where what houses we're looking at mainly. So the ascendant is going to be the patient or the client or the person who's sick. The 7th house is going to be doctors or therapists who are treating them, in addition, of course, to their partner if they have a partner. The 6th house is going to be the house of disease. The 10th house is going to be the treatment on offer. And then you've also got the house of death, which come into play, which will be the 8th, the house of hospitals, which could be the 12th, or vices or addictions, and then the 4th house. So those are just the significant houses. The point I was going to make was that there is a debate in traditional, and you find this in the traditional texts, when you have, say, a naughty planet like Saturn. You know, not all planets can be naughty and all planets can be nice, but like just in general, Saturn tends to be naughty. It defaults towards naughty.
It's called the Great Malefic for a reason. So
exactly right. So, but when you have a naughty planet like Saturn or Mars ruling the 6th house of illness, some authorities say it's better for the 6th ruler, and I know we've talked about this before, but the 6th ruler to be strong in a sign which it enjoys, like in its own domicile or exaltation, and others say it's better for the planet to be in a sign which it is in which it's weak, like in its detriment or fall. And I personally think it can really go either way, depending on the context, like depending on what's happening in the chart and in the person's life. So generally, I wouldn't want, if the 6th ruler is a malefic, I wouldn't want it to be on an angle, for example, whatever state it was in. And I tend to read its strength by sign. It's one testimony potentially of the staying power or force of the disease, but it can go either way. So Saturn in Aquarius could mean a disease that it's very fixed and very firm and stable and powerful, and therefore difficult to treat, particularly if Aquarius was on the cusp of the 6th, so it's in its own sign, it's not going anywhere. But it might be better behaved in certain contexts. So say the person had been diagnosed with a cancer, for example, because Saturn is one of the main, it might actually better behaved, because there'd be less, it'd be a lower grade of cancer. It'd be more likely to be lower grade in a sense, because, you know what I mean? Like the grading of cancer is about how disorganized they are on a cellular level.
If it was in its detriment rather than its right. Oh, I see. So yeah, no, it's an interesting one.
Yeah. So what I'm saying there is, I'll explain myself more fully. So because cancers are more aggressive, the more disorganized they are on a cellular level, and because Saturn is the principle of of structure, of organization, and of limitation. When Saturn's strong in its own sign, like Aquarius or Capricorn, or exalted in Libra, it tends to mean the principle of organization and structure is very strong. It's hyper organized and boundaried. So you might have, with Saturn in Aquarius in and ruling the 6th, you might have a strong fixed disease, which is difficult to shift, very difficult to shift. But if it's a cancer diagnosis, for example, I might suspect, all else being equal, that it might have a lower grade. You know, it might be less. Whereas if it was in the opposite sign in Leo, that might be a disease that was more disorganized. But in another context, maybe if the problem was the person had, I don't know, elephantiasis or lymphatic blockages, or some kind of benign tumor in the brain, it might be better to have Saturn in Leo, because it's not going to block the legs up or block the head up as effectively as Saturn in Aquarius would.
It's an interesting one, Marcos. I mean, I'm not sure I've ever gone that far. I tend to look at and one of the first things I do, which you know is pretty basic anyway, is to look at the strength of the planet signifying disease to the patient.
Yes, exactly.
And in a way, because, you know, as I'm sure you know, you can get like the most hideous diseases, but if the patient is strong, they can, you know, almost shrug them off, sort of thing.
Exactly.
But if someone is already debilitated, they can't. And so I'm kind of looking like, you know, okay, this is, you know, this is we've got debilitated um, Saturn in Leo, but actually the patient is in their own sign and they're quite strong. So it's looking quite shitty here, but they can probably handle this. I mean, it's going to depend on a host of other things, obviously, as well.
But that's brilliant. That's where I was thinking to take it next. So that's brilliant. So just to explain that for our viewers and listeners who aren't familiar with these methodologies, because the patient is represented by the ascendant and its ruler. What Ollie's saying is you assess how strong the patient is, in part by looking at, is their planet happy in the sign they're in, and the other and many other factors as well. So say you've got a chart with Scorpio rising. If Mars, the ruler of Scorpio, was in Scorpio, then that would be a very strong patient. That would be someone with a lot of reserves of vitality to draw upon, because the ascendant ruler Mars would be in its own sign, which is a sign of strength, and in an angle, which is a sign of having agency and autonomy. In a chart with Scorpio rising, having Mars in Aries would also indicate a strong patient, but Aries being the sixth sign might well put that Mars in the sixth house of disease. So that might mean a patient who has some reserves of power, but is a bit sicker and may also be actively contributing to their own illness, which is less desirable. So it's all context, but that's so would you, I mean, what you were saying there is you'd compare the strength of the ascendant ruler with the strength and position in the chart of the ascendant ruler.
And that's how, yes, and that's how I would, you know, start the picture being built up. It's like, okay, the disease is in a very, the disease is very happy where it is. That's going to be a problem unless the patient is very happy, you know, it's naturally strong as well, unless it's or the, you know, the disease is very unhappy where it is. So actually, if the patient isn't that strong, they might be able to shift it anyway. I mean, in the example we use, of course, they're both fixed signs. So it's going to be pretty fixed, the diseases. So, but just how easy it is to get rid of them. So I think very, very interesting that. I wonder if Saunders was thinking of that in some of his descriptions. But again,
I don't know. I mean, there's a problem with these cookbooks, isn't it? Because they're sort of all in isolation. They're all elements taken.
He does. Does he in that one where he does talk about the sign, the where the ascendant is as well, isn't it? Or is it all by ascendant? I can't remember. I can't remember his method exactly.
I know. I'd have to dive back in and read.
Maybe we'll have to do an episode on Saunders separately. And
yes,
then we can
I think so. I think that would be good in future, and I'll probably have to reread the whole thing because I tend to just use bits out of Saunders, you know, dip in and out.
It might be interesting to do. I mean, we don't have to necessarily read all the cookbook stuff, but definitely his sort of technique and where you go to from that.
Oh yes, yeah, definitely. All right, so we've done a little intro. So we're going to do a second part to this in the next episode, where we'll be looking at a couple of charts just from my client archives, a couple of consultation charts, and really looking about what you've just been describing there, Ollie, like looking at the planet that represents the disease and the planet that represents the patient in those scenarios. And maybe also the ruler of the 10th house, the planet that represents the 10th house, the treatment on offer, but particularly focusing on the disease and the patient, seeing which is stronger in the sign particularly. And I've tried to pick examples where we've got examples of sort of like domicile and exaltation versus detriment and fall, just to see how it worked out. So we'll be doing that next time. So
okay, anyway, looking forward to it. See you then.
Excellent. All right. Lovely to see you and lovely to see you, everyone. Thank you for watching. And if you've enjoyed this, please like it, share it, do all the things, and definitely come next time where we'll be looking at some charts. So